My name is Dr. NEZAMI, and I want to talk a little bit about the science of epigenetics. As you may have heard, cancer is a byproduct of many conditions that lead into an interaction of genes and environment that causes the disease. This interaction of the environment and the genes are influenced by epigenetics. Epigenetics means above the gene. The term philosophically first was used by Apostle. And what they meant by was there are things that we cannot describe by molecular findings. We know the genes, we can describe them. Now as we speak in 21st century, we can code them and tell you exactly what the genetic markup of a creature is. But what we don't know is why two individuals, identical twins, with exactly the same genetic markup, one gets cancer and the other one doesn't. If the cancer was only caused by genes, it should have happened in identical twins, but only one of them is impacted. And for the longest time, we didn't know what is the reason that the other one doesn't get cancer. So we realized that there is something that influences the genetic transcription, and that is called epigenetics. Epigenetics, or above the gene, is a chemical reaction that happens in certain areas of the nucleotide and DNA. I always give example of a tie. Imagine that this tie is my DNA that I was born with. I could not change my DNA or genes. In this tie, there are white lines and there are also blue strips. If you think that the blue strips are the bad genes or the cancer genes, what we call oncopromoter genes, and the white lines are good genes, or what we call oncosuppressor genes, the genes that suppress the cancer. There is a balance between the two, meaning that the good genes or white stripes control the bad genes or blue stripes. So I don't get cancer. Everyone, every human is born that way. But unfortunately, something happens during the growth and development of the fetus or as a child, that these white lines that are supposed to control the bad genes stop working. What causes this epigenetic aberrancy, as we call, is unknown. They have done many experiments to find out why in one individual these genes stop functioning. But what we know for sure is that this event is reversible, meaning that whatever caused the insult, that these white lines stopped working, is reversible. And as a result, the disease can be reversed. This is true for cancer as well. This is the fundamental science that we use in our technology called multi-targeted epigenetic therapy, or MTET. We use this technology to reverse the damage in a patient whom at one point of his or her physiological growth and development was impacted by this negative insult. For example, a patient that I see at the age of 60 with lung cancer had never been exposed to smoking, but at one stage of his fetal growth, the mother was, or even the parents were smokers. We see this all the time, that a mother or a father are smokers and the children are paying the price by getting the cancer that is caused by cigarette smoking. Epigenetics are inheritable, as are genetics. And as such, the term was used philosophically as karma. So you can understand and appreciate the fact that we can change the karma, we can reverse the damage, And we can turn back the clock to many decades before the cancer was diagnosed by using a technology that takes advantage of the weakness of epigenetics and its aberrancies, which is its reversibility. Because it's reversible, you can use technologies to turn back the clock. This is not true for genetic aberrancies. If you have somebody with genetic abnormality, you cannot change the genes. But for epigenetics, it's true, you can. There have been fundamental scientific efforts for a long time, I would say at least for the last 2 decades, to find a solution that can do just like what I said. Many drugs have been in trials. Many research have been done. The epigenetic dream team back in 2014 continues to put the efforts on finding drugs that can change the damage, that can use this technology, epigenetic therapy. What is unfortunate is that all the efforts, or almost all the efforts, that has been done, the research that has been done, has failed in changing patient survival when it comes to solid tumors. In some instances, such as leukemias and lymphomas, there are marginal results with epigenetic drugs. The reason that they have failed is that the drugs that they use, unfortunately, are unselective, meaning that they would work on the entire DNA and they unleash not only the oncosuppressor genes, but they also unleash the oncopromoter genes, which are the bad genes, the blue stripes. As the result, patient survival usually does not change. Our technology instead, multi-targeted epigenetic therapy, not only is stronger, and we have done studies to show that, but also is selective, meaning that it only goes after what we call CPG islands on the DNA that are involved with oncosuppressor genes. This is almost a dream come true for someone who is in drug development. I wouldn't say I was smart enough, but I would say I was lucky enough to find this solution. And it came with significant efforts that we have done in the last decade to formulate and specifically design a protocol that could bring this hope and bring these results. We have treated many patients with this treatment, hundreds of patients. And we are very, very happy to see the results, as I just said. The cause of the cancer is treated the same way, and so is the treatment of the cancer for active disease. Epigenetic therapies should be the mainstay and backbone of any other treatment, meaning that if a patient chooses to receive traditional treatments without epigenetic therapies, I would not recommend that. A patient who chooses to receive radiation without epigenetic therapies, I do not recommend that. A patient who chooses to receive surgery without epigenetic therapy, I do not recommend that. As such, we have shown the synergistic effects of epigenetic therapies in this specific protocol with all traditional treatments, including targeted therapies, including chemotherapies, and including radiation. We know for sure that epigenetic therapies maintain the DNA stability, improve patient survival, control growth factors, reduce stem cell plasticity, and at the end, improve patient survival. We are also pleased to say that the cancer recurrence in the patients who receive epigenetic therapy is almost zero. So this is a brief of why we are promoting epigenetic therapies and why we are specifically interested to bring this technology for every cancer patient and in every stage of their disease.